Hi, everyone. I'm Gabrielle Schechter, Senator Schatz's health policy advisor. The senator has been championing telehealth for the past decade, and together with Senator Thune and a group of the Senate Telehealth Working Group leads the Connect for Health Act, which is a consensus piece of legislation on primarily focused on permanent authorities for Medicare to cover telehealth services and make them broadly available. So that is definitely the senator's priorities looking into 2024, which is a big year for telehealth, and I'm sure we'll get into that. So thanks.
Hi, I'm Sarah Schmidt with Senator John Thune, and echo kind of where Gabrielle is at. We've been members of this telehealth working group for many, many years, and really led efforts to push for permanent telehealth policy in Medicare. Senator Thune sits on the Finance Committee, which has jurisdiction over Medicare, and so we've been involved in a lot of these conversations over the years, been also involved in conversations related to telemental health, teleprescribing. Basically, in coming from such a rural state, South Dakota has realized the value of telehealth long ago, and so we've really worked to push a lot of these policies forward and to get kind of the rest of the government thinking and using telehealth. So look forward to talking more about all of that.
Okay, thank you.
Good morning. Thank you for being here. My name is Max Smale. I work with Parkview Health. We're a health system out of Indiana. We have about 12 or 14 hospitals in rural and metro sites, depending on how you count some of those. So thank you for being here today. I think a lot of what we heard this morning, many of us in the room are very appreciative of what the Connect Act represents and some of the items that hopefully will make various components permanent in the long run. So at Parkview, we do about 100,000 video visits a year. We have settled down a little bit from maybe 130, but during the height of the pandemic. But we've been doing them for many years now, about 7 years. Several different patient stories that we could certainly share, but I did want to highlight too, I think that really wouldn't be possible without the geographic restrictions in place. So one of our sites was a patient who went in for an ER visit, chest pain, 50-some-year-old male, was seen by the doctor. We had just implemented telecardiology services there. The ER doctor was a bit of a techie, wanted to try it out. And so literally in the first week of implementing the service, had the telecardiologist on the line who saw something abnormal in the discussion. Within 4 hours, that patient was on a cath lab table receiving treatment. Normal process for that would have been to send that patient home with an outpatient follow-up 2 days later, which is relatively quick in the heart world, and that patient would not have survived those 2 days. So without telemedicine, patient wouldn't be here today, and he has come up in front of a large platform in our health system to share his story on that. Second one was outpatient visit, 80-year-old mother, 50-year-old son with some mental health disabilities. He was totally dependent on his 80-year-old mother. She was going to have to be transferred to a large metro site from a rural community, but that rural community was only about 22 miles from the metro site, so did not meet the geographic limitations. But we were able to do telepsych visit for her, keep her there, and keep her distraught son happy from that visit. So that and countless others, other stories I'm sure many in the room could share is why we think so many of the components that Connect Bill are so important to us. So thank you for being here today. I think all of us are excited about delivering the right care at the right time and the right value to the patients, which I think can be accomplished with telemedicine.
Great, thank you so much, Max. And for those of you who don't know me, I'm Adam Solander. I'm a partner in King & Spalding. Spend a significant amount of my time on telemedicine issues, but you guys really want to hear from them. So I do want to ask a quick question. You guys mentioned the Connect Act, something that's very important to people in this room. Could you just give an overview of sort of where it is, what its chances are, where you see hurdles?
Sure, I'll start. So with the Senate Telehealth Working Group reintroduced the bill in June with the largest amount of co-sponsors the bill has ever had, which is great. So we're now at 62 bipartisan co-sponsors. So very few things, very few policies have that degree of bipartisan support, and so that I think is a good testament of how much broad consensus interest there is in permanent policy, and understanding that would bring a lot of stability to the healthcare system, and so lots of members interested in that, and so the prospects we're now extended through 2024, and I think the prospects are good for continued Medicare coverage of telehealth in the way that we have seen in the pandemic. I think, to be honest, the length of that, I mean, our bosses will push for permanent policy. We will see sort of what plays out in the next year. I don't want to make false promises on that, but certainly the advocacy is towards things like the really core consensus areas around removing geographic restrictions, originating site flexibilities. There was interest, it was actually new to the bill, around removal of in-person requirements for telemental health. There's interest in that. The just continued sort of oversight and data and reporting and transparency, those pieces, there's strong support for. I could go on and on. But Sarah, what else do you think in terms of next year, 2024?
The one thing I would add is, building on that support that we've gotten for the bill itself, the Senate Finance Committee had a hearing a couple weeks ago now on telehealth, and there was just broad consensus about this needs to be permanent. Like what we learned from the pandemic needs to be applied now, and we need to move towards permanent policy. So I think you're hearing from a broad range of stakeholders and policymakers that we need to move toward that. So we're all working now to try to really dig in, work on these policies, get them in a good place so they are ready to move before the end of next year. I think the question in Congress is always like, what's the vehicle and what's the strategy? And so I think that's something we're gonna have to get into more as we get through these funding deadlines at the beginning of next year. But we're really pushing and working hard to make sure that the policies are in a good place so they're ready to go with whatever vehicle may come across. Are we taking
Max, do you have any
audience
follow-up?
questions?
I have a question. So can you distinguish for us a little bit between thoughts on telehealth versus RPM? So telehealth being more on the instant acute medical delivery of something versus the micro data points that RPM is able to provide from a trending perspective. Is there differentiation given to that within the bills that are being discussed?
Yeah, and I think CMS has, so there, the technical part of the Social Security Act, 1834M, that covers telehealth, CMS has used their flexibilities in how to interpret the definitions within the law for telecommunications systems and regulates differently. So they've applied that for real-time audiovisual and primarily, honestly. There are some outstanding questions, and we could get into it around audio only and how that may or may not tell the telecommunications definition applies there, but RPM and virtual check-ins and some other flexibilities, CMS has not used the restrictions of 1834M to then set payment and access and that kind of thing.
I guess that probably brings me to my next question. We've always, I think you probably have a room full of people who are concerned with CBO scoring, and especially going back to 2021, how CBO scored telemedicine as cost increasing, not decreasing. Do you guys see the CBO score as being problematic to this bill? And are you working with CBO on that?
I think that there continues to be, like the perception, the analysis here, and Sarah, I'm sure you have more to say on this, is that there are costs to the system because of the increased access to care. I think there's more and more data that's coming out from the pandemic that that theory of the case doesn't bear out in the data, and so their CBO over time has taken into account those studies and has reduced the score, which is a good sign. But there still is a positive score that then will have to be offset by some other policy. So that is ultimately a hurdle that we have to. And I'm not sure, CBO has longstanding and affects a ton of policies, not just telehealth, around, prevention, and does that lead to downstream cost savings and all of that? And they just have a view on that. I don't know, Sarah, what else?
Yeah, I think the more data that we are able to get to CBO, the more data that exists, the better the case will be. And that's, CBO, when they do their analyses, they do talk to stakeholders in the real world. They go and look for data. So I think we're able to influence their assumptions as so much as there is data that exists on this policy. So I think that's where you all as stakeholders can be helpful in trying to, make sure that we have that data that we're able to share with them. I do think, a lot of things up here cost money, and I think a lot of people are cognizant that telehealth, while the score is coming down and we can hope for that, it still is likely to probably cost something. But that's something we're going to work through with the Finance Committee and try to figure out, where there could be pay-fors for that. And I think at the end of the day, if Congress believes in this policy, we want to enact policy, and we will find pay-fors to get there. So.
Yeah, makes sense. And just to ask sort of a nerdy follow-up, if you'll allow me to, do you think the definition of RPM within telemedicine in Connect is something that would increase that score more, or do you think those things could be separated and scored differently?
I think we'd have to take a look. That's not the intention of and there are no changes to the definition in 1834M of telecommunication systems, so we can take that back. We got a heads up on that one, and see about any changes that might need to be made in for enacting the policy.
Sounds great. Thank you. Max, you want to ask the next one?
Next question, sure. Okay, so I'm not as familiar with all the DC steps here. So can you walk us through a little bit of what happens next with the Connect Act? And then I guess follow-up question, do you see barriers or hurdles out there that are being discussed, or what are the common concerns that you may hear of people who object to it? Are people worried about fraud still, or other components to that? Any barriers that you hear that maybe others in the room can also help in the future?
Sure. So now that the bill's been introduced, introduced with a lot of co-sponsors. Usually we still want to build those co-sponsors too, so please reach out to, members' offices and try to build support, because that is definitely still helpful. The next step is really to work with the Finance Committee to make sure that, this is on their radar and that we can move this bill through the committee process, since it is under the finance jurisdiction. So we're working through that now. We're working with CMS to make sure the bill is operational for CMS, so that if we need to make any technical changes or anything like that, that makes sure that they can actually implement what Congress tells them to do. So there's a lot of back and forth that usually happens there, and then we'll need to have CBO in a good place and have their updated scoring as well. So those are some of the next steps. I don't know, what else am I missing?
Yeah, I mean, I think that, and the, there's a conferencing process between the Senate and the House side, and so the House has their, and we speak on the Senate side. Yeah. I'm less conversant, honestly, on the House side. So, I think in terms of your question on the where there are concerns or questions, I think because COVID was the ultimate test case for telehealth, that would never have, we would have been in a very different place if not for COVID. The questions go to what probably another or the questions that we got, let's say from members in the co-sponsor gathering process, are around, the audio-only issues that we actually did not include in the bill because there wasn't strong consensus yet on the future of that, or what that should look like. There was consensus that Medicare should continue to pay, but what the policies around that. I think there are questions. I think there are questions around the ability of quality measures and the rigor of the quality measures, and whether they reflect and truly incorporate the telehealth models and hybrid models of in-person and telehealth. And so there are outstanding questions there and potentially more work to do on that. And yeah, I think that those are the main things that come to mind.
Yeah, I think the fraud and abuse argument has come up less, I think, because we have put in good guardrails within the bill. But I think for folks maybe that aren't as familiar with the policy, this sometimes can still be raised. But, we have great guardrails that we've instituted in the bill that we've pointed folks to. So that's less a concern, I'd say.
Yeah, and I think that having the HHS Office of the Inspector General and all of the Inspector Generals that had VA did more, and all parts of the system did more during COVID, really looked at trends of fraud and abuse and really found very, very minimal, but did offer the HHS Office of the Inspector General offered some reviewed the bill and offered some technical assistance around where, because they have a whole process by which they screen claims and how to sort of make that a permanent part of our system and how CMS might incorporate some of their screening processes and stuff. So to Sarah's point, we've tried to bake that in and take lessons learned from COVID.
Great, thank you. I think we've probably covered that to death at this point. I guess I want to switch subjects. We're running out of time, and I want to make sure people have a chance to ask you guys some questions. But are you guys doing anything with the DEA right now on finalizing the prescribing rule? What are you guys hearing over on the Senate side?
So Senator Thune led a letter with Senator Warner earlier this year, right before the DEA had those listening sessions, urging them to, one, institute a special registration process because it's long overdue, even though Congress has told them to do this many times. But then, also, urging them on the rule. And then they subsequently issued their temporary rule to extend the prescribing policies till the end of 2024. So now there is alignment in all of the telehealth policies for the end of 24, including the DEA policies. There is an effort right now. There's legislation that would remove the in-person requirement for teleprescribing for controlled substances. That I know there's a great group of members on that bill, and there's a push to include that with the SUPPORT Act, which the Help Committee is marking up next week. So there's a lot of conversations in the Senate and in the House about how we address some of these policies that the DEA has taken on. But I think, what we saw in the listening sessions, it seems that DEA may be kind of changing some of their tune on this. We're hopeful, at least, but as Congress, we're going to continue to press them until they do finally implement special registration, and make sure that there is flexibility around these policies.
Max, any follow-up?
Well, I think just a quick comment and then maybe open it up for questions. I think from our end as a healthcare provider group, digital health is just healthcare, right? I mean, a lot of people say that. So it's just a different modality to deliver healthcare for the patients. And so the great thing about talking about the permanence of some of this is that we can continue to make this an option for patients to choose how they want to receive that care. So some of our goal, I know there's a lot of discussion of what percentage of healthcare is being delivered with telemedicine, but I think the ultimate goal is to just ask, is 100% of the time are we giving patients the option to choose whether to come in and see us or whether to have a virtual visit? And so I think as we move towards permanency, that sticking will be very helpful, and been very grateful that as an outcome of the pandemic that we've been able to move so quickly with some of that. I know you had a question up front. Did you want to start with that?
Thank you guys for coming. My name is Fernando Porter. I am a primary care physician here in DC and in Maryland. And I had a couple comments. One was as far as the how people think about some of the things that your opposition may have as far as quality and I guess utilization and that type of thing. I would ask or have folks give consideration to looking at value-based care models because the entire purpose of that model is to lower the cost of care however you do it, right? And so many of those models run on a hybrid model, and it does depend on some fee-for-service, right? And it's mainly because these people still have staff to pay, they still have benefits to pay, they still have a brick and mortar practice to pay. And so that kind of goes into the, I guess, the compensation aspect of it, into Medicare keeping it kind of at the levels that they are, because that piece still has to be maintained. And then the second thing is, can we get a little bit more of a notice that this is going to, even if the can is being kicked down the road, before December of 2024. It is that's a big deal for a lot of health systems. I know somebody in here said that they would retire if it got to that point, and then all of a sudden it was swept from under the rug just because of how much operational effort that it would take. So consideration to, even if it is just going to be pushed down the line, if it looks like that's going to be the case, the healthcare community in general, particularly healthcare providers, would really appreciate it being done sooner than later, just so we can, kind of continue and be able to plan for just even an operations piece or the access that we need to have to our patients.
Yeah, I definitely hear that. Congress loves a good deadline, and but I think actually, the Congress acted actually in the last telehealth extension before we had to. The technically speaking, it was, the expiration was based on the public health emergency date, and it was 151 days after the public health emergency. And because there was so much uncertainty and all the will they extend, won't they extend, having a more permanent, and set marker was, I think, the smart thing to do. Our bosses advocated for that. And so it was before that pending deadline. We'll see kind of what again, as Sarah was saying, around having the right vehicle. And you've seen how, passing legislation in this Congress, there are a lot of factors at play with that. And so telehealth is hopefully one of the less controversial topics on the table. So.
Oh, she's on.
This is just quick. I just had a question that I communicated to Krista. What about national safety? So talking about telehealth expansion, telehealth this, telehealth that, what about the science behind the next pandemic? that is going to affect operations again, and maybe we won't be at 100% shut down for a year again as we were this last time. But depending on the kind of diseases that are lurking out there, I'm wondering if the science is being considered in the fact that having telehealth implemented is going to save money to everybody, in the fact that people wouldn't have to stay home. People would still get health care. People would learn more about the next COVID in a timely fashion from their healthcare providers via telehealth. So I'm just wondering if an inclusion of science would help move this forward instead of just finance? Because I mean, there's all those other financial aspects of everybody lost money. People are spending that money that they got as a booster incorrectly, and there's fraud in that. Like, what about keeping people working? So, I mean, that would just seem to help.
Yeah, I think, having all of the arguments, because different arguments speak to different members, and so I think that's good. The Congress has done a fair amount to respond, obviously during pandemic, and then, past various measures, and there's, around pandemic preparedness, and is thinking about, all of that. I don't know.
Yeah, and I think, for a lot of us from rural states, there's so many ways that we need telehealth that, the arguments are beyond just, I think, a financing mechanism, but I think it's helpful to have everything on the table, so that depending on, a member's state or a member's interests, making sure that we are making all those arguments.
So, Lisa Mae Williams from Intercept Telehealth. So with all of the discussion surrounding telehealth, we also have the acute care hospital home program that also is going to have some limitations, and it's not broad enough, in my opinion. So have there been any discussions surrounding expanding that, including it in the Connect for Health Act, for example, or other bills, as this is really the future of where we're heading, to be able to provide more acute care within the home so that patients will do better. So I'm curious, is there a conversation, and if so, what are those conversations?
Yeah, I know the hospital at home program, we found a lot of value in our state, and I've heard from our providers that have used it, and the patients that have really benefited from it. And I think that's true of many members of Congress. And so there has been discussion about the value. I think there's a lot of support for the program. So I think that will help propel it moving forward in the future, and recognition that this is possible to do acute hospital care at home. So I think there's a lot of support. I think that will be very helpful. I don't have a definite sense on the outlook there, other than I think, we're going to try to push for that as well.
After we deal with the whole telehealth PHE waivers, then they probably will come back to it, or could it be included, do you think?
I think it's unclear, the scope of what a package could look like that would include Connect Act, because there are some of these other policies, like I mentioned, the teleprescribing and the DEA policies. So I think there's other things that could potentially be included, but at this point, it's really tough to say. So I think the advocacy around all of these programs is really important.
Markup, were you referring to the Senate markup last week or the week before when you initially started?
Oh, there was a hearing in the Senate Finance Committee that was, I believe it was 2 weeks ago now, 3 weeks ago. It all blends together. Yeah.
So I had concerns. I brought it up to Senator Hassan's team about them removing. Oh, I'm sorry. I'm referring to her pulling out the amendment to ensure MAT for the Medicaid population, and what's going behind closed doors. I know it's coming across the aisle when we're supposed to be bipartisan, so I know they're going to try to put it back in, but I get real concerned when I hear Medicare, and Medicaid's left out of a lot of stuff. And I just don't see the focus, if that makes sense. At least her Addiction Act mandated that all states cover Medicaid. And now we have an opportunity to maybe change some narrative in her act to say include telehealth, include monitoring. Like we have a chance to maybe put it back in. I don't know where you sit on that or if I'm just soapboxing for you.
Well, we've been talking about Medicare because that is the scope of this legislation, and I think it's just Medicaid policy is just very different because of the way that the Medicaid program is run as a federal state partnership, and so and I think there have been a lot of advancements in telehealth coverage from state Medicaid programs, and there are good resources available about what that outlook looks like. But it's again, it goes to the states and state legislatures about sort of setting their rules of the road with the Medicaid program. So you'll see more when it comes to Medicaid policy on things like what is the federal matching rate for Medicaid for a specific policy? What direction can CMS give to state Medicaid directors? Like those are the kinds of policies that usually come out in our past. Fewer on mandating that states, cover a specific. I don't know what else to. Anything else on that?
Yeah, I think there was some discussion. There was a markup at the Finance Committee on much broader than telehealth, but where there was a discussion of some of the demonstration programs in Medicaid and what to do about some of those in the future. And I think there's a lot of support for MAT. We've seen the success of MAT, et cetera. So that is a discussion point. And I think at that point, I'd have to remind myself of the back and forth that happened on that amendment, but I think it was just that it wasn't necessarily ready yet for that package. It didn't fit within that package. It wasn't that. I think there was. I don't know. I'd have to go back and look honestly because I don't remember that discussion. But I think there is support for MAT more broadly.
So on the topic of giving more time, as you heard, everyone started clapping about that. It is an election year, so I would take 151 days, even though that seemed really arbitrary. Do you think that's something, and I recognize that you're just guessing here, but is that something that we will hear in the first quarter of next year? Because I think there's real, these are businesses that cannot turn on dimes and actually have to make fiscal decisions around, they're making plans 3 to 5 years out, and these decisions are, and I know I'm preaching to the choir around that, but any thoughts around some specificity around when we might hear what that timeline might be?
Yeah, I think it's really hard to say right now. I think at this point, I think Congress is focused on January 19th and February 2nd and getting those funding bills done. And then I think after that, we'll be able to turn and look at these expiring 2024 priorities and have a more concerted focus on those. In the meantime, we are working and trying to do everything we can to get these policies moved forward before we're in December of 2024. But just to kind of give you an overarching view, I think it's, the 19th is the date in everyone's mind right now to get through first to make sure the government's funded.
I think though, communicating to your representatives around why all of this, why you applauded, why we need to not wait till the 11th hour on this, and why it should be permanent policy, and why that makes a difference. I think all of that is always very helpful. I know that when I hear from Hawaii constituents, I take it extremely seriously, right? And so going to your representatives and saying, please, make this a top priority. It really matters because I think, as we've said, telehealth has a really good chance, but it is, not the new sexy thing on the street anymore, right? And so it's always good to sort of say, let's keep it on people's radar, and that it should, it's really important to maintain coverage.
So if I could just follow up on that question a little bit. 62 sponsors in the Senate, and if I'm just doing the math, that's more than half, so that's great.
Well done.
Thank you. The companion bill, though, in the House, I just looked it up, looks like it only has 18 sponsors. Is that right, or am I just reading the...
Yeah, I think that the just House leads didn't make a big push on generating co-sponsors. That's a sort of, choice that they... But it's not, doesn't indicate a lack of, if you were to look at past, it was,
Right.
hundreds. So that's, yeah.
Yeah, but I'm wondering, what is the opposition, if you will, right? Because CBO doesn't have a vote, right? We already have Senate where 62 people have said that they're going to vote, presumably yes to it. So direct the room here. What is the opposition, and where should people focus their efforts? Is it on representatives who might have a more decision point about this? Is it back to CBO again, and do we need to reduce the score? Is it a budget neutrality issue where they have to have a pay for? If it's not particularly expensive, why can't it just be a separate standalone policy? But what is the opposition, and do they need to go to their House members and say, hey, you guys need to hop on this bill, because there's just not as much support in the House right now to get these sort of corresponding bills developed?
I think leaning on the House side, that is, and on House Ways and Means would be helpful. I think so. On both sides of the aisle. But I think ultimately, I think it comes down to what are the suite of looking at all the 2024 provisions. What are all of members' priorities? How does this shake up? It'll be high on the list for lots of members, but what is the cost of all of them together, and what can we afford? And that's ultimate. And so that's why I say go championing this will help say, okay, those other things are maybe less important and shouldn't get the top bill. It's honestly, it's just, that's where we are, I think, on this.
Perfect. Well, I'm going to go ahead and stop here. We're at time. I just want to thank you guys so much for coming here, giving us such thoughtful answers, and thank you for continuing to work with us.
Thank you, guys. That was perfect. All right. We are going to take a break for 15 minutes, and when we come back, we'll have lunch, and we'll begin with the next presentation. All right?